Initially, I noticed an ad in the local paper, and I applied for it mainly because of an incident that involved my mother-in-law. She had been here at Health Sciences North, and during her last days, what turned out to be her last days, my wife had noticed some issues that were more or less related to communications. The care itself was wonderful, but there were some gaps in the communications that she felt were missing, and as a result of that, that just encouraged me to participate. Well, honestly, I didn't have a whole lot of expectations. This was something relatively new. But what I had hoped that could happen is that I could bring the voice of a typical patient and or family member to that table. And when I say that table, that includes all conversations of healthcare. I've been involved with a small group, something as simple as reviewing the literature that goes out to our patients and families. I found that interesting because more often than not, and certainly the business that I'm in, we often send out communiques to our clients. And what I found is that since I've been involved in, and I would imagine the same thing in the healthcare system, since you're involved in the system for so long, you don't necessarily think of communications in terms of the language of the client to it's going to. So that I found very interesting and informative. Being able to understand from my point of view, from the patient's point of view, from the family point of view, what is it that I'm reading, and do I clearly understand that? I think communications have certainly improved. Do we have some work to do yet? Most certainly. One of the questions that I know I was asked at the onset was, when will you know, when do you feel that we've succeeded? And I've always said from day one, I don't think we'll ever get to that point where we can say we've arrived, we've accomplished everything, and there's no work yet to be done. I think when it comes to healthcare, there are always going to be improvements, always opportunities to improve upon the good work that is currently being done. Get involved, and I say that quite honestly because I have had the opportunity to sit down with frontline staff, managers, VP, and the CEO, both as a group at a table and individually, to not only share with them my story, but share with them my issues and concerns. And that's been a wonderful experience. I think it's my responsibility to go out to the community, at every opportunity that's available to me, to speak out to community members, to let them know that, first of all, there is this thing we call a Patient and Family Advisory Council. Let them know that I, along with you, can be a part of it, can be a part of that process. And it's our responsibility as patients and families to do those things like speak up, ask questions, and get involved. Because after all, I believe the healthcare system belongs to us as patients.